Here's a painful truth about getting older. You're going to have more pain. And that can be in the form of joint pain, muscle pain, arthritic pain, and so forth. Now, for most of us, muscle pain is usually in the back, especially the lower back. Now, that's my personal issue as well. Then we have joint pain, such as the knees, the elbows, the shoulders, and also the hand wrist area. For me, it's for sure my shoulders and knees, and in the past years, even my elbow pain has started to come on. So what are the primary causes of such pain, especially this more long-term chronic pain? There are a couple of reasons, but the underlying cause is usually the same in almost all the cases. For the joint pain, it can just be simple wear and tear. Like for me, it's just years of sports and weightlifting. And the cause is usually due to maybe less fluid and collagen and similar substances around the joints, ligaments, and tendons, just like wear and tear. And for the muscle pain, such as the low back pain, it can be muscle tightness, as well as less fluid in the muscles. And this gives you that tight feeling and then eventual pain. However, an underlying cause of all of this is inflammation. That's right, inflammation is the main problem in here. And the cause of inflammation has many different factors. First of all, we have hormonal imbalances. That's one big factor. Lack of stem cells is another as we get older. Now, lifestyle factors such as diet, the type of exercise, and also stress and stress management and so forth. And yes, simple aging is a factor, and this is why scientists have coined the term inflammaging, all right? Because aging causes inflammation. Now, if you recall from some of my previous videos, I went to Panama a couple years ago and spent over $30,000 and did full body stem cells to help reduce the inflammation in my body. And this is the same place that Mel Gibson and Tony Robbins and various professional athletes went to as well. It did work really well for me, at least that first year, and then now 2 years later, some of the pain has come back. So it's definitely not permanent, and again, for the price, for most people, it's just not doable. I also take various supplements to help with the inflammation. The best ones for me have been fish oil and also an all-in-one solution called Inflame and Pain Relief. Now, I also do follow an anti-inflammatory diet. I posted links below to this topic in the description area, and of course, I'll be talking about in future videos in detail as well. Now, if you're overweight, simply losing excess body fat will help reduce the pain and inflammation. And this is not just because you're losing weight, also hormonal reasons. Now, sleep is also very important. Most people, let's be honest, aren't getting enough sleep, especially that deep quality restorative REM sleep. Getting enough sunlight, and most people aren't getting enough sunlight, therefore we're lacking enough vitamin D and K. So make sure you take these vitamins as well. Ideally get in the sun. Most of us can't. Now, massage is also very helpful. I love getting massages, but it needs to be done at least once a week. And of course, it can get very expensive over time. Now, as far as what not to do, forget about taking pain medications such as NSAIDs, which is non-steroidal anti-inflammatory drugs. These would be, for example, ibuprofen and Advil, acetaminophen, Tylenol, and similar drugs. Now, the effects here are temporary and will cause you actually more pain when you get off of them. And then you all obviously know you have to get off of them sooner or later because they are so liver and kidney toxic. Then we have the steroidal anti-inflammatory drugs such as prednisone or similar cortisol type drugs. And these are literally stress pills, which do reduce inflammation temporarily, but cause massive damage to the entire body and brain. They're, I believe, horrible drugs that basically kill your muscles, increase body fat, blood sugar, blood pressure, cholesterol, and so on and so forth. Super toxic for the entire body, but a small percentage of people need them to live, but 99% of us don't. So just because your doctor prescribed it, maybe you should look deeper into it and think about other alternatives. So aging leads to more pain and inflammation. Negative hormonal changes, again, due to aging, lack of stem cells, and lifestyle, negative lifestyle habits accelerates the inflammatory response and hence causes more pain. And in order to reduce pain, you really do need to reduce inflammation. So what are the 5 best ways to reduce inflammation? Well, first of all, adopt a more anti-inflammatory lifestyle. Lose excess weight, especially that extra body fat. I suggest taking more fish oil, about 3 to 4 grams a day. Add in some vitamin D3 plus K2, and also take Inflame and Pain Relief. It's just an all-in-one supplement, super easy and convenient, has tons of special herbs and vitamins. The benefit with the supplements, these 3 supplements that I mentioned, is they're easy to take and anyone can do them. So at least start with them so you get some relief. It's the lifestyle changes, right, that requires the most effort and time and money. But again, start with the easy stuff and slowly make more improvements over time. I've put links to all of these important solutions below in the description area. The older you get, the worse the problem will get, and the more inflammation and the more pain you will have. So please don't be like other people. Don't just listen, all right? Be active, take action, because this situation isn't going to magically fix itself.